And less than a year after COVID-19 was discovered, scientists are already talking about rolling out vaccines that could end the global pandemic sooner than anyone could have imagined. But there are fears over the speed of which the vaccines have been produced. And in the black community, these fears are rooted in historical instances of vaccines being used against them in the past. So, will the vaccine be taken up by all? For Arise News, Afia Adam has the story.
It's the breakthrough we've all been waiting for. The silver bullet that will allow life to return to some kind of normal. The COVID-19 vaccine. With 3 groups, Pfizer and BioNTech, Moderna and AstraZeneca in conjunction with Oxford University, all producing vaccines with up to 94% efficacy, governments are snapping up doses and people are finally dreaming of life beyond lockdown. But during vaccine trials, initially out of 270,000 people who put their names on the NHS vaccine registry, just 1,200, that's less than 0.5%, were from Black, African and Caribbean backgrounds. This is against the backdrop of black people disproportionately dying from COVID-19. We make up 14% of the British population, yet represent a third of all hospital admissions for COVID-19. Black people are also twice as likely to die from the virus than their white counterparts. But the black community remains sceptical about vaccines, largely in part due to fake news and conspiracy theories that have mushroomed online since the start of the pandemic.
I don't want to take it.
Why?
Because I think they're selling the corona too much, like the COVID-19 thing. I think it's more about control now to me.
I wouldn't have it straight away. I'll wait for, reviews and evaluation and people's opinion and experience about it, because from my point of view, I think the process was just too quick, so I'd rather wait and see the outcome before I can be vaccinated. Yes.
No, I wouldn't.
Why not?
I don't have no confidence in it, firstly, and I'm not sure what they're doing and what their plans are. So for myself, I wouldn't have it.
I don't trust the government because we've not trusted them so far with every information that has come out. And they keep insisting on pushing and saying it's for the ethnic minority and they're the ones who are more vulnerable to this. So it makes me question if it's a general thing, why not just say everyone?
This scepticism has got to come from somewhere. The question is, what are the reasons behind it? There are so many reasons for the lack of conviction around the COVID-19 vaccine, and of course this isn't limited to the black community. The anti-vaxxer movement has gained a lot of traction across all communities, with online forums dedicated to this topic popping up across social media. But a critical factor is the deep and justified lack of trust that many black people here in the UK and in the US have for the healthcare system in general and clinical research in particular. This distrust is often traced to the legacy of the infamous syphilis study of the Tuskegee Airmen, in which investigators withheld treatment from hundreds of black men in order to study the natural history of the disease. But this distrust is far more deeply rooted in centuries of well-documented examples of racist exploitation by doctors and researchers, as well as high statistics of death rates in maternal health for black women. Consultant psychiatrist Chichi Obuaya says stopping the spread of misinformation is key.
I think the most important thing for people to do is to be well informed, and that seems to be a huge challenge when we're talking about healthcare, politics, and so many important things at the moment. So getting information from reliable sources, like Arise News, of course, but going to mainstream platforms and just being careful if information's coming through that hasn't been verified on the various popular social media platforms, looking at the source of the information as the starting point. And yes, there's an issue around what information people want to believe, but if you are getting information from respected and renowned scientists, that surely has to carry more weight than anecdotal reports that haven't had that sort of journalistic oversight.
So, how safe is the vaccine really? Dr. Taiwo Olatunji is a general practitioner. He says that vaccines really wouldn't come to market unless they had been properly tested.
From a personal point of view, I guess the easiest way to convey the message is to say, I would advocate the vaccine for my own mother. So that means I believe that it has gone through the rigors of trial, and I can basically say from a personal perspective, I think it's relatively safe. And I can say that having been through some of the documents from the vaccine makers, I think generally what the public perception about the vaccine, there is something we call vaccine hesitancy. Vaccine hesitancy is basically the refusal or the refusal to want to take up the vaccine based on some skepticism. And we know that there's a lot of misinformation out there about COVID vaccines and maybe vaccines in general. And a lot of people have their doubts about it. But plain and simple, I think the vaccines are safe. Yes, we don't know everything about the vaccine at the moment, but based on the public information available about the vaccines, we know that generally the adverse events with these vaccines are within what was expected of a vaccine of this type.
It would be wrong, as well as ineffective, to ask black communities to simply be more trusting. Clinicians, investigators, and pharmaceutical companies need to provide convincing evidence sufficient to overcome the extensive historical evidence to the contrary that they are in fact trustworthy. This trust needs to be earned and needs to be addressed as a priority as vaccines are preparing to be rolled out. This effort would need to be firmly grounded in grassroots involvement of individuals and organisations with solid, well-earned reputations for trustworthiness in black and other minority communities, including respected elected representatives, trusted local and national faith leaders, community advocates and others. In addition to this, vaccines need to be fairly accessible when they are available. Only by doing this valuable work will any COVID-19 vaccine really become a silver bullet for all. Afia Adom, Arise News.